So I know you have additional treatment approaches that you use. Will you outline those and let us know when would you think of using, what kind of situations would you think of using those?
Yeah, that's a good question. Overall, you essentially experience kind of what our base of best recommendation would be from taking your own tissue and applying it to it, right? But one of the things that I'm passionate about is expanding past the diseased joint and thinking about what other tissues and mechanisms are affected above and below, right? So let's take a knee, for example, right? There's studies that have been done that have found that upwards of 75% of patients that have knee arthritis have trigger points in their quad and their hamstrings. And there's some studies that have found that even when you just hit the trigger points without doing anything to the knee, you can get a high percentage of people that will reduce their pain significantly. And so I never got trained on trigger point treatment per se. You know, I'll hit some of the basic ones, right? But there's a lot of practitioners and providers that I know that was part of their training, which is great. For me though, I like to utilize something called shockwave treatment or shockwave therapy. And that's two machines that I have here in-house. One is a radial pressure wave machine, the other is considered a focused shockwave machine. What's great about that is I can use the patient's own biofeedback in the way of pain of showing me where those trigger points actually are. And the more that I've done that, which I've been doing for about 6 years now, the more you recognize a very typical constellation pattern for whatever kind of diseased joint that you're dealing with. So the example again with the knee, almost 75% of patients will have vastus medialis and vastus lateralis trigger points. And you can look through any sort of books that are pertaining to trigger points, and they'll show you exactly within the millimeter of where most humans get those types of trigger points. And it's very consistent when I use the shockwave machine. So the idea behind that is we're breaking that cycle of that chronic constriction of those muscles that are related to the instability of that joint, and we start to normalize that.
What does it feel like?
Kind of depends on where you're doing it and what type of tissue you're hitting. When it hits the muscle, it feels like somebody's kind of squeezing that individual muscle in that individual space. What's also interesting about it and very eye-opening for people is it can also hit the referral pattern, and it actually seems to talk to the other muscle groups that are affected as well. So I've done it on people where I hit their hip and they'll feel it down into their foot. Because that whole biomechanical chain that's been abnormal for potentially years related to joint problems is all affected, and it's all cascaded into damage on itself, right? And so we have to try and unravel that damage, and oftentimes they don't like the fact that you're trying to change them, and so they kind of communicate back and forth. But once you can do that, then you can start to hone in and kind of peel those layers off that onion and try and get it down to normalizing all of that soft tissue.
So acupuncture does that. How is this different?
Yeah, good question. Acupuncture is actually very similar to that, and I love it when patients come in and have experience with acupuncture. So acupuncturists discuss meridian lines, right? That's very similar to like the myofascial type of syndromes that we deal with, or the myofascial communication pattern. It's essentially the same thing, right? And so all of that is talking. So those people that have had acupuncture before, they'll say, oh wow, I typically feel my acupuncture effect in, say, you know, my jaw or my left arm or something like that. And when you do the shockwave, they will feel that same sensation. Where it comes, where it's potentially different, the vibration from the shockwave that we use will actually vibrate the tissue, or actually the fluid that the cells basically swim around in, which is called the extracellular matrix. And by altering that, it alters the communication pattern between cells. And where that helps, say, in something specific like muscle tissue, is that if you have a trigger point causing the myofascial syndrome, that muscle is constantly constricted.
Yeah.
And that leads to a whole host of issues. It squeezes the muscle and therefore squeezes the blood flow to the muscle, so that decreases. It's using energy constantly, which means that when you need to use that muscle, the energy's not there to do it.
Yeah.
And then all of that process leads to inflammatory mediators, so you get localized pain related to it.
Yeah.
Moving that extracellular matrix and changing that cellular pattern in communication will actually break the cycle of that constant constriction, and that will start to ease all of those types of things. And as you get the accumulation of the energy over time, that will sustain itself longer and longer and longer, so you eventually get to the point where that muscle only constricts when you ask it to.
So you're re-educating it.
You're re-educated.
Yeah.